Hello everyone, today is June the 10th. I'm Dr. Adam London, Director of the Kent County Health Department, here for today's COVID-19 update. Across the state of Michigan, it's reported there are 59,107 positive diagnosed cases of COVID-19. That was an increase of 108 over yesterday's number, and 5,698 deaths in total statewide, an increase of 25 over the previous day. Here in Kent County, yesterday's reported number was 3,966. That was an increase of 12 over the previous day, and that 12 is actually the lowest number that we've had as our official day's reported new case number since April the 7th. So that's very positive news. Right now we have 2,503 people who have recovered from COVID-19 and 1,357 who are considered active cases at this time. Our deaths are now 106. So sadly, we had 3 additional deaths reported yesterday. And a little more information about those deaths. The average age of a person dying in Kent County from COVID-19 is 76.9 years. However, we have seen quite a bit of a range on that, where we've had one person pass who was in their 30s, 5 people in their 40s, and 7 in their 50s. And so while this does tend to be a disease that most severely affects the older and people with underlying health conditions, we are seeing some range in that. And some people are saying, well, I don't have to worry because I don't have any underlying health conditions. And I would just encourage people to reflect on that a little more carefully because the data that we have shows that 45% of all Americans actually do have an underlying condition of one sort or another, ranging from asthma to obesity, hypertension, lung disease, heart disease. There are so many underlying issues which could complicate an infection with COVID-19. And so while overall our numbers are continuing to trend in a positive direction, we need to be careful and we need to be smart going forward. We're now hearing that 19 states are seeing an increase in their numbers once again. And a couple of those states, which previously had lifted their stay-at-home orders in mid-May, are now starting to reconsider those decisions. In fact, Texas, which was one of the earliest states to lift a stay-at-home order, is now seeing the highest number of people hospitalized for COVID-19 that they've seen thus far. So that's concerning. Concerning but not surprising, because in many ways the landscape has not changed very much for COVID-19. We know that less than 5% of all Americans have been exposed to this virus, and so the vast majority of people are still vulnerable to infection. And we did flatten the curve, and I think that was a testament to everyone, all of you, for all the sacrifices that you made, making it difficult for this virus to spread. That was quite a lift on the part of everyone across the country and in other countries around the world who employed similar strategies to flatten that curve. And that was done successfully to the point where we did not overwhelm our healthcare institutions here in West Michigan and in many other places. But now we're in this long phase of this pandemic where we don't have vaccine yet, we don't have medical therapies yet, and many people are still, most people are still vulnerable to this. And so we have to live and navigate very carefully these waters for the next 9 months to a year or longer until we actually have herd immunity through vaccination. So that's where we need you. We need you to continue to be smart, continue to follow the public health advice, continue to wear masks, be smart about where you're going and what kind of a group setting you're going to, trying to avoid mass gatherings, working from home as much as possible, staying home if you're sick, all of these things that we've talked about over the past several months. We need to really rely on one another to maintain discipline to those public health recommendations so that we can get through this with as little human suffering as possible. And we need to stay positive because positivity matters when it comes to overall wellness and health. Stay positive, stay heroic, and stay healthy. And I'll talk to you again tomorrow. I'm Dr. Adam London for the Kent County Health Department. Thank you very much.